Hello, my name is Anita Srdanovic, Parris, currently attending class at Touro College, Dr. Levy's class, SPED602. I am going to be talking about emotional and behavioral disorders, which are also known as EBD. Emotional and behavioral disorders. EBD refers to a condition which behavioral and emotional responses of an individual in school are extremely different from those of his peers. About 9% of all students receiving special education services are classified as having behavioral problems, and out of those 80% who are identified as having emotional and behavioral disorders are taught in the general education classroom and the regular schools. The idea definition of EBD. The idea identifies EBD as a condition exhibiting one or more of the following characteristics over a long period of time, and to a marked degree which adversely affects a child's educational performance, and an inability to learn which cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory relationship with peers and teachers, and inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, or a tendency to develop physical symptoms or fears associated with personal and social problems. The term includes schizophrenia. The term does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance under the first part of its definition. What causes EBD? Causes remain elusive. However, the relationship between the causal factors and disability are becoming more clear through studies conducted. Some environmental causes can include family factors such as being poor, living in an abusive environment, lack of supervision, and so on. School factors such as high expectations, teachers' feedback, and social isolation can also be a type of cause. Society factors such as feeling of not belonging. It has been stated that genetics, which are more prone to cause mood disorders, depression, and schizophrenia, are also causes of EBD. The combination of environment and genetics has great effect on students exhibiting the symptoms of EBD. Possible characteristics of individuals with EBD. These characteristics vary from males and females due to the gender differences and preferences. The characteristics also different across the age, cultural backgrounds, ethnicity, and so forth. Students who exhibit internalizing and externalizing behaviors, which is different than those of their peers, are looked upon as having EBD. Performing below grade levels for 1 to 2 years of school and also having difficulties in engaging tasks, exhibiting challenging behaviors are also clear signs of EBD. Now, identifying students with EBD can be done through interviews with parents and teachers, use of different assessments, through observations, and use of functional behavioral assessments and data collection, use of behavior rating scales, personality assessments, and other tools to determine and identify students with EBD. How are students with EBD classified? These students are classified through educational aspects of exhibiting internalizing and externalizing behaviors, through dimensional factors of exhibiting oppositional disorder, conduct disorder, social and emotional problems, socializing aggression, anxiety withdrawal, psychotic behavior, motor tension, and at times medical aspects can also be taken into consideration as being one of the classification for these students. Internalizing behavior disorder. The individual experiences an anxiety and withdrawal which can exhibit itself in a form of separation anxiety, in a generalized anxiety, different types of phobias, anorexia or even bulimia, different forms of depression, post-traumatic stress disorder, and even schizophrenia. The externalizing behavior disorder would represent itself as the individual exhibits patterns of under-socialized aggressiveness, which includes immaturity, which involves short attention span, preoccupation, daydreaming, sluggishness, etc. The attention problem, hitting and physical abuse, motor excess such as unawareness of behavioral expectations. Externalizing behavioral disorders can also express themselves through socialized aggressiveness, which includes socializing delinquency such as gang involvement and awareness of behavioral expectations, and so on. The oppositional disorder, these would include extreme anger, blaming, hostility, or vindictive behavior towards others or even oneself. Individual exhibits repetitive, angry outbursts, easily annoyed by others. The individual rejects praises and might sabotage activity when being praised. Examples of such would be tearing up artwork, crushing down building creations, destroying work, etc. Deliberately annoys and provokes others to engage in fights, and so on, would also be a part of oppositional disorder. The conduct disorder refers to a repetitive and persistent pattern in which the basic rights of others are violated in regards to individual who bullies or intimidates them, who initiates physical fights, who uses weapons to cause physical harm, present cruelty to animals, and so forth. The individual destroys property by setting fires, breaking and destroying property, and so forth. An individual who is deceitful or who steals, who defies all of the rules by staying out late at night, skips schools, and so forth. Other disorder can include eating disorders, tic disorder, which pertains to involuntary movements of body, elimination disorder, which pertains to soiling and wetting in older children, selective mutism, which pertains to refusal to talk, stereotypical movement disorder, referring to recurring purposeless motor behaviors. How do we teach students with EBD? We can teach them through early intervention, direct instruction, cognitive behavioral intervention, behaviors management interventions, positive redirection, behavior intervention plan, positive reinforcers, attention compliance, and basically ignoring behaviors which are unacceptable. What do we teach students with EBD? Most of the time we have to focus on academic skills and curriculum content, social skills and positive interaction, classroom conduct, respect to self, others, and environment, responsibility and self-management, self-control, self-purpose, and taking pride in one's achievements. Behavioral management techniques that we can use can consist of positive reinforcers, contingency contracts, differentiated instruction, token economy, self-management, group consequences, making up contracts, providing expectations, and service learning and good behavior. Other techniques that can be used and considered in teaching these children can consist of play therapy, creative dramatics, pharmacological treatment, and bibliotherapy, which pertains to use of different types of literature or books to help children and teens heal their social, emotional, behavioral, and personal problems. Consideration for structural environment is also important. Providing safe environment, providing structure and consistency, maximizing academic engagements, implement school-wide positive behavior supports, classroom management techniques, encouraging peer tutoring, students' motivation in teaching towards students' interest, and providing individual and group contingencies are very important. Use of instructional technology can be considered as well. Computer-based activities will enable the students to work individually or in smaller groups for more positive interaction and less stressful intervention. Self-paced lessons, which will provide students with enough time to complete tasks and lessons and learn the content more effectively. Self-monitoring will enable students to check their own work as they complete it through the use of spell checks, grammar checkers, and so forth. The use of behavioral intervention plans to promote intervention and strategies to address behavioral concerns can also be implemented. Transition planning. Vocational life skills need to be taught in order for students to transition easily. Preparation for post-secondary educational environment is necessary to avoid disruption and to prepare students to adapt to the environment more easily. Engagement skills are taught to students understand how to engage in learning, interaction, socializing, and how to express his or her needs and interests. Other considerations can be providing effective instruction, providing safe environment, showing respect for students, planning differentiated instruction, collaboration with other professionals, demonstration of sensitivity, modeling desired behavior, and providing behavioral supports for these students to make their days at school easier. Other supports can include family-driven instruction and planning support for families in dealing with EBD. Families need to be provided with tools to help cope and deal with their children who have been diagnosed with the EBD. Involvement of community, family, mental health, and other related services can be implemented. Community outreach programs and support for individualized interests can also be some of the supports provided. As special educators, we need to find different ways to support students with EBD and assuring that the classroom environment is safe and nurturing and as productive as possible in order to give these individuals room to grow, be themselves, be respected and appreciated for their abilities. We need to role model the expected behavior, and we need to promote positive interaction and participation through use of positive reinforcers, redirection, and praise. Through collaboration with other professionals and families, we will be able to establish good rapport, and through effective classroom arrangements and classroom management techniques, as well as productive curriculum implementation, we will be able to help these individuals achieve their goals and learn how to control their behavior in more respectful ways possible.